The following presentation demonstrates Trim PEMA temporary crown and bridge material. The same technique may be used with Trim Plus PMMA temporary crown and bridge material.
First of all, on the mouth, we'll use one of the cherry-ways fitted for size. Once that is good, we will then apply the tack adhesive. The material is very sticky. I apply it where I'm going to put the alginate and occasionally even outside for additional retention. Gently fold it into the tray so you don't get any voids. Then I come to the patient's mouth and I gently seat it in the patient's mouth for the construction of the permanent bridge. We will cover them with the Bosworth mask lubricant, silicone lubricant. I have the unprepared teeth, and I use the B crown with some wax to stabilize it. Okay, it's set up very nicely. Remove this. The pontic with the wax popped out, so I'll just grab that, pull that out. Save this model for the laboratory so they could have an idea how the teeth looked and what I constructed. Okay, now we have a beautiful impression of the models. There's some excess I like to just trim off. Now sometimes what happens is a practitioner may put too much, or if they have their staff doing this, in which will overflow everywhere. And it will not really mimic the mouth. So once I have this, before I fill it up with the trim, I always like to go back and practice going in the mouth to make sure everything fits right. Model for the temporary bridge, we now get the trim. Once again, there are two boxes or types of trim. Trim 2 has the multiple shades, and they also have a wonderful little pipette. We'll use the pipette, draw some of the liquid. It is calibrated. It's nice, you have some control, it doesn't spill all over. We are doing a fixed bridge. The material is very affordable, so I'd rather have extra than too little. Like I said, I'm going to use the dark powder, and I'm going to start flowing it in. I'll spatulate gently to wet the particles so it's not lumpy. As you can see, they're getting wetted. Now I'm getting a nice creamy material. I like to go with the spatula and keep just working it off the side. I don't really want to mix because I don't want to trap any air bubbles. It causes voids. And the rolling will just help keep wetting the particles nicely. Put just a little bit more, and basically rule of thumb is once you start seeing the powder gently, slowly get wetted, it's usually ready to be used. Okay, it's nice and creamy. There's one little bubble, but basically it's pretty solid. Now the next trick is to try to flow it in nicely into the prepared area. Now I took that off the model, and here's abutment, pontic, and abutment. Now what I want to do is make sure I get enough around the margin, so I will generally go with a periodontal instrument or a lab knife, and I will scoop away a little bit of the interproximals and of the margin area. So this way I can get nice margins on the material. It will flow nicely. And it's just gently trimming. Okay, so the areas of the abutment, the pontic and the abutment are ready. And the consistency is just beautiful. I like to try to flow it in gently and nicely, right in the middle, and let it flow into the cusp areas. And usually start one area and then let the material roll into the others. I do not want to lump it in, clump it in, because then I will trap air and have voids, which I will have to be patching up. And you can see how the material flowing towards the back motor, and I just like to work it in. I have plenty of working time. Basically, you have several minutes. And the hardest part is to decide if I have enough. Now this is a bridge, so this area is needed for the pontic area, so I'm going to put a little bit more to make sure it flows nicely over the margins. The alginate tray and the material is now on the prep teeth. And we like this consistency. As you see, I overfilled it some, and I'm now picking it off the adjacent teeth, and even try to tease it off now, off the models, in what's called the second stage set, in which it able to rebound. I'm able to put it on and off. I just keep teasing it, and it's setting up beautifully. If this was a single unit I was doing, I would have it off already in the pressure pot. Because of the possible distortion between the two teeth, I like to tease it off some. Now the outer layer is setting up probably a little quicker than the inner layer, which means the pontic, which is basically all acrylic, will need to be cured a little bit longer. Flow it into the so-called gingival sulcus area of the prepared teeth. Now comes off. What I like to do is just trim a little bit. So I'm trimming away where it may lock in approximately. Clean out a little bit from inside the mouth that's trapped. Goes back on nicely. I remove it again, and it's just starting to generate heat. At that time then, I will go to my pressure pot. Generally, I will do this in the sink. I'll use lukewarm water, fill it up, place temporary inside, or denture repair if I'm doing that. Put some more water. Like I said, I do this in the sink because when I put it on, I want to overfill, don't want to trap any air. I then place the top. The excess water will then run out. I will then place it back in and crank it down. And if I did it right, you'll see the pressure gauge go up, showing that I am pressurizing the pot inside, and this will result in a firmer, harder, should be more accurate temporary. See how this is setting up. It's getting nice and hard. It still goes on beautifully back on the teeth. And there's the color. Now the next step we do is, once it's nice and hard, is to trim it. As I said before, on the impression of the plaster model, I removed a little bit of the alginate so that I could have a little bit thicker margins. And that helps for the staff who will be trimming this up and shaping it so they could see exactly where the margin is. Also, too, you must remember by the pontic area to trim it out so the patient can have a cleansable area and you're not impinging upon the gingival tissue. This time now I will finish trimming this up and then come back and try it in as a final product and make any adjustments as needed. I trimmed up the model of the fabrication of the temporary is now completed. I'll let it sit in there for a few minutes. I would check with an Explorer till it gets firm. At that time I will pop it off, retrim, and then repolish with my various burrs, sandpaper discs, and then pumice. Once we reach that point in which the occlusion is satisfactory, the margins are all closed, and the appearance aesthetically looks good, I will then apply the glaze. Bosworth glaze comes in a nice little package. There's two components. There is the glaze itself, and then there's the solvent. Margins are sealed, and it's a beautiful glaze, cemented in the patient's mouth, and they are ready to go. That will remove any eugenol. If I use the eugenol base cement, I will then go with the burr, notch the area, say the margin if some of it flaked off again, do the salt and pepper technique again, and add to it. Unless you're expanding the bridge or adding another tooth, I would Vaseline or mask the part where I don't want bonded, roughen up some of the temporary bridge, and at that time I could continually add to the material. And then finish it off and have a beautiful, stable temporary while the laboratory is making the final product. Thank you.